Hello, I'm Justin Karlin, Oculoplastic Surgeon, and I'm here today at the Appearance Center in Newport Beach, answering your questions about oculoplastic surgery. What is oculoplastics? So oculoplastics is essentially eye plastic surgery. We do plastic surgery around the eyes. We handle the delicate tissues carefully.
Careful, SpongeBob! Careful, SpongeBob! SpongeBob, careful! Careful, SpongeBob!
We use our eye surgery techniques or microsurgery techniques along with plastic surgery techniques to be able to keep the eye safe while also enhancing the function as well as the aesthetics of the eyelids and surrounding tissue. People always tell me I look tired, but I don't want surgery. Help!
Oh my God!
I get this from patients all the time. So patients often come in stating when they look in the mirror, it doesn't match up with what they feel on the inside.
You talking to me?
And that can be manifested as looking tired, even though they don't feel tired. If surgery is not something the patient wants, then what we can do for patients is offer certain procedures such as Botox injection or filler injection. Surgery is more versatile in that you can address specific tissues, but it requires more downtime. Botox and fillers and other non-surgical options have less downtime, but oftentimes aren't as versatile and need to be done repeatedly. What is a brow lift? On the googly eyes, what is a brow lift? Well, I thought you'd never ask. A brow lift is a procedure that's meant to raise the eyebrow tissue. Now, that could mean multiple different types of surgeries. So there are brow lifts that can be performed in the scalp, in the hair-bearing scalp, where the entire scalp is moved up. An endoscopic brow lift is just behind the hairline, where the forehead skin is kept intact and a camera is introduced to raise up the entire forehead and brow complex. In certain patients who have wrinkles on the forehead, a direct brow lift can be performed where an incision is actually made either in the middle of the forehead or just above the eyebrows to lift up the eyebrows and free up some of the tissue of the eyelids to allow for either clearer vision or a more aesthetic appearance. Are eyelash growth serums safe? Can they change my eye color? Eyelash growth serums such as Latisse or blepharoplasty have long been known to cause an increase in the length and thickness of eyelashes when placed regularly using a mascara brush on the eyelashes themselves. Now, in certain patients who are susceptible, overuse of Latisse or other eyelash serums can cause several side effects. One side effect that we worry about is that it can actually cause darkening of the upper eyelid skin. Another side effect is it can actually worsen upper eyelid hollowness because these medicines have a tendency to cause eyelid fat to shrink. Now, the next question here, can they change my eye color? The answer is yes. In certain patients, long-term use of eyelash serums such as Latisse can cause patients with green eyes to have permanent, irreversible browning of the eyes. So it's something to watch out for. In patients with green eyes, I will never prescribe Latisse. And in patients who insist on using Latisse, I will counsel them to only use the smallest amount needed just on the eyelashes and not on the skin. What is a blepharoplasty? Now, that's a good question. What is a blepharoplasty? Blepharoplasty is eyelid surgery, and we're typically talking about surgery on the skin and soft tissues of the eyelids. Now, blepharoplasty is often meant to address aesthetic changes around the eyes, but blepharoplasty of the upper eyelid can be performed if extra skin and fatty tissue is weighing down on the eyelid such that it may be blocking the vision. Aesthetic blepharoplasty involves shaping of the muscle, the skin, and the fat of the upper eyelid, sculpting it to get a more aesthetic appearance. And that involves controlling how much of the eyelid platform is showing, as well as where the position of the so-called eyelid crease might be. For lower blepharoplasty, this is always an aesthetic procedure. Lower blepharoplasty involves shaping the fat of the lower eyelid as well as the skin to be able to create a smooth transition from the eyelid to the cheek. Occasionally, we'll also perform simultaneous skin treatments such as nanofat injection or laser skin resurfacing.
Sharks with frickin' laser beams attached to their heads.
And In addition, we may also put in a natural filler that your body has everywhere, which is fat, micro-fat injection for the orbital rim hollow. What that means is we can efface or smoothen out some of the dark circles of the lower eyelid using your own body's fat. Will a blepharoplasty make me look younger?
I'll make you 20 years younger.
Great question. Us surgeons have known for a long time that blepharoplasty can help patients look and even feel younger when they look in the mirror. Recently, a study by my group showed that blepharoplasty, on average, tends to make patients look several years younger when their photographs are analyzed with artificial intelligence.
I'm sorry, Dave. I'm afraid I can't do that.
So we have both subjective and objective evidence that blepharoplasties do have the potential to make patients look younger. Thanks for watching. If you are interested in learning more, you can reach out to me and book a consultation at the Appearance Center in Newport Beach, or check out my Instagram at Justin Karlin, MD.